care physician says to a patient, you know what, you need to lose some weight because you're at risk of diabetes, and I've got a good exercise program that makes sense, and here's a dietitian that you should talk to. Sometimes Medicare may not reimburse that consultation. They'll reimburse the $30,000 foot amputation because after somebody gets the disease. Well, that doesn't make sense. So changing our reimbursement system to encourage preventive care and encourage what primary care physicians do is probably going to be the single most important thing that we can do to assure that you and those of you who have good primary care physicians continue to get that kind of care. Last point I'll make, and I just want to go back to this point that I made during my remarks. About a decade ago, I guess, and Barbara, correct me if I'm getting the timing wrong, but about a decade ago, Congress, not our Congress, but previous Congress, made the decision that the way we were going to actually cut Medicare, or cut the rising costs of Medicare, was to say to doctors and providers, cap you at a certain level, and if you don't, tough luck. And in theory, it sounded good, but it wasn't very well thought through. And so what happened was, each year, the costs for doctors went up, and the reimbursements did. And eventually it got so bad that Congress then started saying, you know what, this isn't realistic. So each year they'd kind of do a patchwork fix on this thing. And the formula for reimbursing Medicare doctors would be adjusted, but it would only be adjusted for a year, adjusted for 2 years, but it wouldn't get adjusted permanently. And what's happened is over time, it's built up so that now each year you end up having this emergency where unless Congress passes a bill right away, suddenly Medicare doctors are going to get a 21% cut in reimbursements because all that healthcare inflation had built up over time. We're now in this situation again, and we got to fix this permanently. Now, in the meantime, temporarily, we got to make sure that your doctor can reimburse so that they can stay in business and keep their doors open. And my administration has worked very closely with doctors, tried to see if we can get this fixed short term, but ultimately we're going to have to get it fixed long term. What we want is a system where doctors are reimbursed for the right things. We want them reimbursed for quality. We want them reimbursed for how good care you can get, you're giving patients. We don't want doctors just to be reimbursed for how many tests they do or how many procedures they do, because sometimes that may mean that they're not given the best care. Quality, not quantity. So there are adjustments we need to make over the long term in how we reimburse doctors. But what we shouldn't do is have this guillotine hanging over their heads every year. They're having to figure out, am I going to get reimbursed, or is suddenly my income going to drop by 20%? Because what will happen is more and more people will say, I don't want to be a Medicare doctor. Be a primary care physician for somebody on Medicare because it's going to make my income unstable. That's something that we've got to fix.
Thank you, Mr. President. Before we take the next question from the operator, I just want to add one thing to that great answer, which is to tell you that the President has been focused from the beginning of the discussion about health reform on the workforce, understanding that it's great to say everybody should get great medical care, we'll have more access. It said over and over again, what about the docs? What about the nurses? What about the nurse practitioners? What if we don't have enough people? How are we going to deal with this? So really starting in the Recovery Act, the second piece of legislation that was signed, thanks to members of Congress and the President, there was the beginning of more scholarships, more incentives for a whole range of healthcare practitioners. That really got increased in the Affordable Care Act that was just signed. It's in the budgets in the future. It's going to be continued. But I want to thank you, Mr. President, because as the discussion went on in Congress, it often didn't get enough attention, but I can tell you, because I had the privilege of seeing the president on a very regular basis during this discussion, that was constantly a focus of his. We have to make sure we have not only the doctors and nurses and nurse practitioners, but the primary care, the gerontologists, the folks who are going to take care of the entire population. And that's been a focus, and I think it will continue to be a focus.
Good.
Operator, if you are still there, it's hard because we can't see you, so I assume you're still there. Is there another question from audience listening in?
Your next call is from Barbara Culp from Denver, Colorado. Barbara, please ask your question.
Mr. President, this is Barbara Culp.
How are you?
I'm a participant of Mays Center. I would like to have you answer a question.
I'm all ready.
For leading health care reform, I am concerned about how any health care changes will impact seniors and choice around alternatives to having to go live in a nursing home. My friends and I want to live independently.
Well, it is a great question. And let me just say, you sound like a woman after my grandmother's heart. She, some of you know my grandmother passed away 4 years ago. She helped raise me, so I was very close to her. And she lived in Hawaii, and after my grandfather passed away, the same little apartment she had had when I had been growing up over there. And we kept on trying to say, you know, why don't you move to Chicago? And she said, what, am I, an idiot? And I am going to trade 80 degrees and trade winds for Chicago winter. But she was always very proud and insistent. And until the end of her life, she insisted on making sure that she could live in her apartment. And, you know, there are all kinds of different options for different people. What key is we want to give choice to seniors. What's best for them? People love living in a retirement facility. Some people want to stay in their own house. Some people want a mix of options. And so if they can get some help that comes in, that may be the best option. And what we try to do, not just in this law, but what we're trying to do generally, and I want Secretary Sebelius to fill in some of the specifics on this, is increase the number of options that are available for people, and make sure that we are reimbursing Medicare not just for the traditional choices of, you know, if you're in a nursing home, they're going to do it one way or another, but are there other ways that people can get maybe a nurse who comes in, or maybe somebody who's cleaning the apartment for once a week? That's what my grandmother did, for example, and made all the difference because she couldn't always reach to some of the places. Barbara's all nodding. She can relate to that. Yeah, so those are the kinds of innovations and flexibility that we want to introduce into the system. Some of this will be facilitated by the new law. Some of it will be facilitated by the ongoing improvements that we want to institute over the next several years. So it's not going to happen all at once. But go ahead.
Thank you,